Just about all of us experience back and knee pain, especially as we get older, and there are several new ways in which chiropractic medicine can help. To demonstrate these techniques and treatments, we're joined by chiropractor Mike Milinkovic. Mike, thanks for coming today.
Thank you for having me, Larry.
So Mike, traditionally we think of chiropractors as maybe just manipulating the back, but there's a lot more to it now, isn't that right?
There is, Larry. Part of the discussion here is that as we're aging, we have to sort of alternate the way we traditionally use our techniques. According to the U.S. Census, 1 in 5 Americans are predicted to be over the age of 65. And even from 1990 to 2000, those living at the age of 100, which we call centenarians, has increased from 35,000 to 50,000. So it presents a whole new set of health challenges, in particular those that are functional. So getting around, moving, bathing, driving, and being active in the community becomes increasingly difficult as we age. And chiropractic has been shown to be very effective for neck pain, low back pain, and headaches, according to the research.
What kind of barriers is the aging population presenting to you now?
Well, a lot of patients that come in the office have severe osteoporosis, and that's the condition where you have a thinning of the bones and the bones get very brittle. And also another one would be osteoarthritis. And osteoarthritis looks like you would see in this model here, where the joints become very compact and tight.
Where's the joint space there?
So the joint space would be on the back side here. We have the two joints, one on each side, and you can see the disc that sits and is sandwiched in between, and how it's a lot thinner in a patient presenting with this with back pain or neck pain or other conditions.
Now, how do you know they have osteoporosis? And how do you know the joint space is gone? Do you do an X-ray on everybody who comes in?
For especially the older adult population, we definitely do an X-ray, because that shows us to what extent their arthritis has gotten to. It also allows us to formulate a treatment plan that is very unique for this generation of patients.
So any area that you're going to manipulate, do you always get an X-ray, or is based on more the back? Say if they have shoulder pain, will you get an X-ray of that too?
Depending on different circumstances, we would also do an evaluation, and if there's something that clues us and hints into seeing whether or not we have to look into it further, then we would at that point decide.
Now, some people, you know their osteoporosis just by feeling their hands, but do you base your pressure and all the other manipulations based on how much osteoporosis they have? Are you more gentle with them? Or
Absolutely.
Yeah.
You have to be a lot more gentle, because the spine isn't moving, and you're not going to get it to a point where it's moving like in a 20-year-old.
Yeah.
So you have to be extremely gentle. But you know, the adjustment is really looking at restoring the structure, the alignment and the movement, which then affects the function of joint as it's dictated by the nervous system.
One thing I never understood, though, if the joint space, if the cartilage or the disc is gone and you manipulate it back in place, what keeps it back in place if there's not that disc there anymore? So you can manipulate, why does it stay in place?
The manipulation is geared towards loosening up some of the adhesions in the joint,
Okay.
in the actual joint itself. And that happens with aging. As you know, cartilage changes and joints become stiffer, so the adjustment helps to reduce that. It sort of makes it, you know, instead of grinding the joint,
Right.
it allows it to be more springy.
So once you do that, then do you have to put them on some kind of exercise program?
Absolutely, yeah.
To keep the muscles strong and everything?
Exactly, and adjustment is only one part of keeping the spine healthy and moving, and then the other part would be what we send the patient home with as far as their exercises and other
So
activities.
the chiropractic care is not just manipulating and you're out the door, it's a comprehensive type program.
It is when it comes to joints. Any joint in the body, we can work on shoulders, elbows, knees, a variety of different joints, and you know, patients will say that they feel not only that they can move better almost immediately after the adjustment, but they have less pain. They're more mobile. You know, most patients over the age of 85 are bent over quite a bit,
Right.
and that starts to put a lot of compression on the heart, on the lungs, and it affects other areas of the body as well.
So if you do the manipulation and say they had surgery and the spine's fused there, can you do a manipulation on a spine that's been fused?
Absolutely.
Yeah.
You have to be very careful when you use manual procedures. That's the typical or traditional chiropractic adjustment done by hand, because you don't want to upset that particular area. You know, if somebody's had a hip replacement or knee replacement, same thing. You don't want to go in there and manually adjust. But we can work around the areas, and what's more exciting is we have now other tools that we can use to achieve the same result.
And this is one of your new tools here, huh?
And this is, well, this is one of the more traditional tools that we have used in the past. It's been around for several decades. It's a spring-loaded instrument, and it exerts a thrust. And you can see here as I push on it, it's exerting a particular amount of force. And this on the spine allows the joints to get back into their natural motion. But it is very intensive. It's very difficult to use as a practitioner. You get tired after using it all day.
I imagine, right.
And also, there's a lot more to this instrument that I'll show you here. This is one of the newer instruments. It also has a stylus tip. It's controlled electronically.
Yeah.
It has a pretension, and what this does is placed right on the joint, and we call this the facet joint.
So this is the patient's back right here.
So this is the patient's back here. If
Yeah.
they're lying down, for example, we would place the instrument over the area that's out of alignment or not functioning correctly. We put a little pretension and we pull the trigger. And it would exert a direct, a very specific thrust to the area. It does it at a very high speed, which reduces the natural tendency of the body to stiffen up. Because most patients, when they get adjusted, they become very stiff, they're afraid of the adjustment, and then we can't get the result that we're looking for. But the instrument is 100 times faster, according to the studies, than the human hand.
Can you turn it on? Can I see what it's like?
Yeah, absolutely. So here's an example. I'll just show you on my finger here as I put a little pressure, and you can see how my finger moves quite a bit, and we can vary the strength of the instrument as well. And that will open up the area here where the nerves come out and allow it to function a lot better.
Does it hurt when you do that?
It doesn't. What the patient will experience is a gentle tapping on the spine. They'll immediately come off the table and say, you know, I can turn my head better, I can move my back better, my shoulders moving better. They'll feel less pain immediately. And in addition,
just with a few taps like that, or you have to do it for a minute or two?
Yeah, it's actually programmed to do about 12 percussions, and it's a frequency over 2 seconds, and that frequency is designed to match the normal joint frequency. So, you know, everything has a frequency. For instance, a building, a bridge, if an earthquake shakes and rattles, it can bring that bridge and building down, and that's kind of the way this is designed. It's designed in such a way to match closest the frequency of the human spine.
So that's really revolutionized your treatment then, I would think.
It really has, and it's allowed us to treat, like you mentioned, patients who have had surgical procedures and now they have pain in different areas. I even had a patient who came in with a compression fracture, and you know, in the past you would not touch a patient like that.
That's great.
So
you do that once a week or every month, or how do you?
The treatment program is definitely developed individually, so whatever the patient needs, we would get that from the examination, the x-rays, as well as the consultation.
If somebody called your office, what would they ask for to know what this is?
This is called the impulse adjuster. It's a stylus tip adjusting instrument. It's one of several out there, but this one has some of the most randomized control studies behind it, so it's very effective.
And so we're almost out of time. Just quick, those are just go on the end of this?
Now, yeah, these tips here we can replace, and this is really effective. If you've ever seen patients that come into your office and they have that sort of dowager's hump appearance in their neck, we can use these tips here to achieve a better alignment, and that's what's revolutionary about this instrument.
So even though the population is aging and they're going to need you more, the techniques are advancing and you can do more with sicker people in a way and get them back to a normal life. So you're going to be in business for a long, long time, and that's very encouraging because I'm going to need you very soon. Thank you for coming today. It was a great discussion.
Thank you so much for having me.
I learned a lot.